Good evening. Thank you very much for this invitation. First of all, I would like to say that my colleague, Professor Ilaria Madama, was regret to not be able to be here, but I will try to represent her as better as possible. So, well, I will introduce the project INNOVACARE. It is a project financed by Cariplo Foundation from the region of Lombardy in Italy, and it's developed by the University of Milan together with the San Raffaele University, Università Vita Salute San Raffaele, also from Milan. This project is a 2-year project that actually started only in April of this year. Sorry, can you check the presentation? Otherwise, I cannot follow. Thank you very much. And we'll conclude in March 2020. So basically, we had started to work some months ago. I won't take so much time to tell you why do study long-term care, because I think that you already work for a long time on it. So I will completely focus on the project. And the outline is this. I will tell you about what is INNOVACARE, what have we done, our first step for the literature review, studying the state of the art of long-term care social innovation. And I will try to talk to you a bit about the Italian case. Why are we focusing on the Italian case from a comparative perspective, and a little bit of what will be developed during the next months as part of our empirical research. So if you want to go to the next slide, please. It's difficult to read from here, but I will try my best. So what is it about our project? As I say, we focus on first of all, on the way that social innovation in long-term care can be defined. You were speaking before about the difficulty to define social investment. Well, you also know that defining social innovation, actually, it's very broad. So we depart from this, and after that, we are trying to understand better what kind of policies have been specifically elaborated on this area of social innovation on long-term care, and what has been considered to be appropriate, effective, and until what extent this actually considers and satisfies also the needs, the expectations, and the difficulties of all the stakeholders that are involved. And with this, I mean specifically to this concept that we are using very much, that is the triangle of care, and we refer specifically to caregivers or care workers, mainly foreign workers, care managers, that are the families that are usually the ones living with the care necessities of the elderly, and the care receivers, that sometimes are the ones that actually need to be the most to be taken into consideration, and for health issues or for other considerations are the ones that are not considered. So we depart from this. We have we depart from two approaches, which is the positive approach, what has been done, what has been effective, and the normative approach or concern, what should be done, and what can we do to make these two concerns to find each other. If you can move, please. Our main approach, what are we trying to bring with this specific project? First of all, we want to apply interdisciplinary scientific knowledge at the service of political and social innovation in this specific sector. We depart also from speaking a lot with our stakeholders at the territorial level. Of course, we focus on the Lombardy region, the different provinces of the Lombardy region, and trying to make a comparison with other European projects that have been already developed. But I think one of the most important things is that since the very beginning of the project, as you mentioned also, that sometimes the stakeholders don't know what are we talking about, we really tried, and I can tell you that we had our first presentation, we tried to involve them very much since the very beginning. So I think this will be a positive element of our project. So we have, as I already told you, we are two main institutions, the University of Milan, Università degli Studi di Milano, Università Vita San Raffaele, but we have three research units. In the University of Milan, we have mainly the, let's say, the political science unit that focuses on social innovation and the welfare state, and will be the one that will analyze in deep the projects that have been elaborated and that you also have studied before. The second research unit, which is the one in which I mainly work, focus on the employment part of the phenomenon. And so we try to understand better the link between social innovation, long-term care, and international migrants, and especially female international migrants. For example, in the case of Italy, there is from all the regular domestic workers, around the 70–75% of them are foreign migrants. So we focus on analyzing this link very much, trying to also interview foreign workers. And the third part, the third research unit, focus more on the philosophical and normative side of the phenomenon. So the University Salute Vita San Raffaele will focus mainly on understanding from a philosophical, ethical point of view, the concept of active aging, the concept of autonomy, dependency, and to understand very much, as I said before, the perspective, especially of the elderly. So these are the three research units. If you want to, please go to the yes.
Can you see that?
Yeah, sure, I will try. I'm not over 65, but I start to have problems reading so far. So, as I already say, we try to understand what has been done and what should be done. And we especially want to focus also on the importance of the context in which we are studying this. Because, first of all, we spoke about the stakeholders, but as you already know, stakeholders change for every single context. The kind of actors that are involved, the relations between these actors. So we really want to address the challenge to explore how different local and national conditions may impact on the emergence, growth, and sustainability of socially innovative products and process in long-term care. Can you please go to, okay, these, I can tell you that I cannot read it, but yes, basically here we are focusing on some of the elements of social innovation that that are the drivers on the one hand. What is promoting the implementation of social innovative initiatives on this sector, and what are the main difficulties or barriers? But of course, you can think in so many areas. So we focus, for example, on the legislation, on the kind of actors that are involved, on the sorry, but I need to just, on the existing forms of financing, especially when we speak about the interaction between the public and the private and the different forms that can exist, and on the existence of research network and other kind of foundations that work on this topic. So these are some of the main drivers, whereas the barriers, we have already identified some of them, such as a very strong division between the private and the public funds that work in this area, the lack of funds, especially from the public side, the lack of communication between the different stakeholders, and the lack actually of knowledge of existing services, because sometimes we may think that there is nothing innovative, but during these first months we have realized that there are several initiatives that actually are maybe not like cataloged as social innovation, but still they are. So if you can go to the next slide first. Here, you know them better than me, I think, and these are some of the projects, especially one of my colleagues that works in the Social Innovation and Welfare State Unit. He realized this analysis of all the projects, European projects that have been already developed, and of course you are also there, your research network, so I think that we are learning also from your website about, and what we have done, just like trying to summarize all these first initiatives, is the focus on active aging, on prevention, that was already mentioned, on the multi-actor approach, all the stakeholders that may be involved, and on the need to actually define something as socially innovative when it's empowering in an individual and also let's say the society, the collective group around the person, and the use of the transversal use of ICT as such of the commonalities of these projects. So, thank you very much. So speaking about the Italian case, the particularities of the Italian case start from studying, recognizing, and analyzing the Italian case as a family-based care regime. And if you can show just the next slide here, you will see it much better than me from here, of course. But there is this, the way that we, in analytical terms, let's say, we categorize the existing welfare states in the countries, right? And in this case, we see that Italy, together with other Southern European countries, are mostly categorized as traditional or family-based welfare states. What does that mean? That mostly is the family that actually takes care of the care needs of the elderly, not only, but in particular of the elderly. And usually this is done subsidized by money transfers from the public sector, but actually with such strict kind of controls that can be used to say whether this kind of care needs are being satisfied in the correct way, let's see. And actually, these money transfers are usually used to pay, formally or informally, foreign domestic workers. And this is, in the particular case of Italy, something that we have seen is this is because of two reasons. Maybe because of the lack of sufficient public, let's say, institutions that deal with the phenomena, but also because people, culturally speaking, do prefer to deal with the elderly at home. So it's not I think it's important to recognize that these kind of practices are done not only because of the lack of something, but also because actually people may do prefer to be close, to have the control, let's say, of who is taking care of their elderly. So, and this will be interesting, of course, to compare it with other countries, for example, the preference to deal with this kind of care needs at home or not. So, what does it mean? That in the case of Italy, we have a very polarized kind of system that goes from the completely private organization of care that is related to family to a completely institutionalized solution that means in recovery institutions that actually are not sufficient to deal with the care needs. And in many cases, as I already said, may not be preferred by people. So we are trying to understand better how to create intermediate solutions between the family base and the full institution, and between, again, the private and the public. That's what that's what we mean by intermediate solutions. And of course, we say, well, maybe in this process, the applicability of social innovation products and process may be very useful. So that's where our project depart. Can you go over? In this case, what we are trying to say, why to study Italy? Well, because this is one of the countries in Europe. If Europe has a population that is aging very fast, within Europe, in particular, Italy has a percentage of people over 65, but especially over 80, higher in comparison with other countries. If you go, you can also read it from there. Okay. So, something that was mentioned before is the public expenditure in long-term care. And actually, I'm glad to see that the graph that we have actually coincide with what was presented before. And it was worrying because actually nowadays, if you go forward, you will see, okay, there you have Italy. Nowadays, we are talking about 1.7 around, that's the number that actually was presented before, of expenditure in care, in long-term care. And actually, the graph that was presented before was speaking of 1.2. So actually, I said, well, yes, it seems that there will be older people, and the available funds may be not actually available. So this, I just have the number that there is actually invested nowadays. And what we actually see from here is that the public expenditure is not actually quite low in comparison with other countries. Is higher than the EU average. And actually, if I see it, is the 6th country in the region that is actually investing in public expenditure in long-term care. So what is happening, let's say, with all this money? Let's say how it is invested. And actually, this is, if you go to the next slide, please, this is actually one of the particularities in Italy, because as you say, it's not that is invested much less, but is distributed in a very different way in comparison with other countries that maybe invest the money in, let's say, in institutions that fully deal with the elderly, that are actually organized and managed by the public institution. Whereas in Italy, the money is mostly, you see it in the gray color, is mostly invested in these financial transference that are actually done directly to the families to be the care managers, let's say, the ones that deal with care needs. Yes. Yes, I'm very close. So I will just mention two very particular characteristics. As I said, polarization between family-based, let's say, assistance and full institution. This is one thing. And the other very particular characteristic is fragmentation. Oh, sorry. Fragmentation. Why? Because in the country, if you go to the next slide, please. In the country, you will find actually very different realities. You see that when we make some cross-national comparisons, sometimes we forget that within countries there are so many differences. And the Italian case is particular in this sense because, of course, you may already find so many differences between the North and the South. So I will say, yes, please. Finally, these are some examples of social innovation initiatives that already exist in Italy in different regions, again. And finally, I will just very fast speak about the project. Can I have 3 minutes? Two. Okay. Then I will just tell you that this will be mostly qualitative analysis that will include documentary analysis and semi-structured interviews with, as I said, the 3 members of the triangle of care: caregivers, care workers, and caregivers or care workers, care managers, and care receivers that are the elderly. And if you please go to the to the next one. Well, the stakeholders, as I just said, they have been involved since the very beginning, and they include not only, of course, the universities, but they include the municipalities. The municipality of Milan was present in our first seminar. The region of Lombardy, different areas of the region. There are also involved trade unions, associations that deal with care, and this variety of stakeholders and the involvement from the very beginning has been something very positive. Finally, we go actually to the very final. Here, I would like to leave you this because this will be your first dissemination channel. So if you want to follow what we'll be doing, you can follow Second Welfare. And hopefully we can learn from your project and you can still find something new from what we will develop during the next year. And the very final, this is not only my email, but also the email of the project and where you can contact us in case of comments, critics, of course, and any kind of suggestions to improve our work. Thank you very much for your attention.
Thank you, Claudia, and apologies again for you rushing through these things.